Dr. Gazsi, what are some of the ways you would treat insomnia?
There's a couple different kinds of insomnia. The first, most common kind is I can't fall asleep, of course. And so, we have to look at why they can't fall asleep. And we look at everything from the dark room effect. So sometimes I advise people, put dark drapes on, turn off, put your alarm clock, cover it up with a cloth so you can't see it. Even though if you're not looking at that light, sometimes that's enough to disturb the sleep. We look at things like stimulation during the day that may be carrying over to night. We look at the lifestyle factors. Then secondly, we look at, are there stress issues? Can we help the person cope with stress? Can we teach them a technique to deal with the stress? And then thirdly, we go after the nutrients that we know help to initiate sleep. Okay, so that's the first kind of insomnia. We can use herbs to help quench anxiety if there is anxiety. We can use nutrients to initiate sleep like melatonin. And again, dosage is very important. I've had people say, oh, I tried melatonin and it made me groggy in the morning, and there's a trick to avoid that. So we can use a little tricks to avoid issues while getting the benefit of the nutrients. The second type of insomnia is I fall asleep fine, but I wake up at 2 o'clock in the morning, or I wake up 3 times during the night. I have disturbed sleep. And that's usually an issue with the adrenal glands again and the peaks and valleys of cortisol. Very common in the perimenopause years when the adrenal glands are being overworked. And what we have to quiet the adrenals at night. We have to calm them down. And there are specific herbal formulas that do help with that. And there are also lifestyle things that we can do as well to decrease the cortisol at night so they sleep more soundly. It's interesting, I actually get patients who will say to me, well, I get up 3 times a night to go to the bathroom. That's why I get up. I'm like, well, really what's happening is they're not sleeping soundly. So they're getting up 3 times to go to the bathroom because they're not sleeping soundly. If we get them sleeping soundly, they won't wake up 3 times to go to the bathroom. It's not the bathroom that's waking them up. They're waking up and going, well, I might as well go. I'm awake now.